Okay, so this is actually the last class of October. There's a very important announcement I have to make. It's regarding next week's lesson. Okay, I understand that next week is Deepawali. All right, so if you know, I also am celebrating Deepawali. It's importantly a very important festival for me. However, in November, there will be a week that I cannot make it. Or there will be 1 week that I can't make it to the class. So I don't want to have another day that, do replacement class, because a lot of you have different commitments and different tuition and all that things, right? So what I am suggesting is next Thursday, our class will be ongoing as usual, 6 to 8. Okay, so for those who are celebrating Deepawali, okay, that you cannot make it to the class, I hope you can watch the recording, because that recording will not be deleted soon. The reason is because it belongs to November class 1. So I repeat, next week, Thursday, the class will be ongoing as usual from 6 to 8, and that it belongs to November class 1. So you all still have a long time to watch the recording if you all can't make it to the class. Okay, and the reason being, in November, I think it's the 3rd week of November, we will have no class because I'm going to oversee the time. Okay, one of the weeks lah. And our condition is that we need to have at least 4 classes per month. That's the commitment that I have already set. All right. So okay, are you all aware of that? I hope you all are well aware of that. So next week's our lesson will be as usual. Okay. So before I start our lesson for today, I received a very interesting question last week that I believe I should discuss with you all. It's actually this question. So are you all seeing the same picture that I'm seeing? Okay. So I've got this one student asking me, how do we actually analyze this picture? Which one is actually intercostal muscle and which one is actually how do we analyze this picture in short? Okay. So this picture was I would say it was a last time video question. Nowadays it's a very seldom asked already, but if it really comes out as a KBAT question, you need to know how to answer this well. Okay. So let me tell you the principle behind this question. Okay. So first of all right, is that this mimics the side view of our ribcage. That means this view is actually the side view. You're looking at me like this, okay, from the side. So you can see that this is the sternum. Sternum is the chest bone here. This is the sternum. So you're looking at me like this, okay. This picture is showing you at the side view. So sternum is in front, okay. And obviously, what is W, guys? What do you think is W? Write in the chat box and let me know. So if this is the sternum, okay, what is this W? What is W? The W is the spine. Is the vertebral column lah. You can in your syllabus you call this as the vertebral column. Vertebral column. Okay, in simple way, it's the backbone lah, ataupun the tulang belakang. So this is the tulang belakang W. This one is the tulang belakang. So what will be this stick that connect the sternum to the rib? Which I mentioned the answer already, but basically it's just a bone that connect your sternum to your spine. So that bone will be your rib. So this bone over here, the bone X over here is rib. Okay, like what this student have already mentioned. But the difficulty, the students have problem to differentiate whether is this intercostal muscle internal or external. That's the thing they don't know how to see. Okay, I want you to imagine about breathing mechanism. Okay, so when we talk about breathing mechanism, when we talk about inhalation, tarikan nafas. Okay, inhalation, the ribcage move upwards or downwards. Answer me this question in the chat box, please. When we do inhalation, the ribcage move upwards or downwards? Upwards, right? So that means the sternum will move upwards. Basically the vertebral column is constant, it won't move, okay? But the sternum will move upwards and upwards. But here you can see upwards, you can see upwards. So it goes up, right? So this is inhalation, tarikan nafas. So during inhalation, okay, the sternum should move upwards. So I want you to observe, I want you to imagine if this stick goes upwards, ON, so we got 2 strands here. Let's just label this, okay? Let's label this as purple color. Okay, this is purple color. Okay, let's say this is orange color. Let's say. Okay, so we got 2 strands, purple and orange. Okay, so when I pull this up, this is at the same place. I pull this up. Can you tell me the purple will be longer or the orange will be longer when I pull this upwards? Tell me this question. Simple. Okay, answer me this question. It's a logic. When I pull this up, the purple will be longer or the orange will be longer? Definitely, it's the purple color, right? So it will be stretched. Maybe it looks like this later, right? It's stretched upwards, so it goes up like this, right? It's stretched upwards, right? It's stretched upwards, and then the orange color maybe will be shorter. It will be like this, right? Shorter a bit. Can you imagine? Okay. So I want you to tell me, apakah itu contraction of muscle? What is muscle contraction? Can you tell me? What is the meaning of muscle contraction? In Bahasa Melayu, it's called pengecutan otot. It's when the muscle becomes short or become long. If the muscle contract, the muscle becomes short or become long. Important. Muscle becomes short or muscle become long. Muscle becomes short. Okay? Muscle becomes short. So in this case, if I mimic in our reality, when the sternum goes up, that means the orange color muscle contract or the purple color muscle contract. Answer me. Can you relate? Can you understand what I'm talking about? The orange color contract or the purple color? Of course, you look at the short one, isn't it? So the orange color one. So then let me ask you back the question. During inhalation, external or internal intercostal muscle contract. During inhalation, external or internal intercostal muscle contract. External. So that means this orange color muscle is external or internal. You understand what it's external? So this orange color one is external. EIM. And the purple one is IIM. When a muscle is long, that means it's relaxed. So your job is to imagine. So why we build this thing actually as a model is because when we go up and down to mimic inhalation and exhalation, you can see that these intercostal muscles, they are moving shorter and longer rhythmically. So that shows the antagonistic action of the external and intercostal muscle and internal intercostal muscle. So in the exam, you just have to imagine when you pull the sternum up, which one is longer, that is the muscle that relaxes. Am I clear? If this comes out in KBAT question, this is how you answer it. Okay, and this is important because I don't think any teacher will teach you this anymore. This is sort of like an old question, but important. So I am happy because the student asked this question, and I didn't reply her because I want to answer this in front of everyone because I don't think she's the only one who cannot understand. There will be more students who don't understand. Okay, and this question is KBAT lah. All right, like I say, I give you all the homework. Whatever questions that no one asked me, I won't discuss. You ask me only I discuss. But I have given all the answers up to date. Okay, I've given up to chapter 9. So please check your answers. I posted all the answers up to chapter 9. Chapter 10 I haven't posted yet because I have not finished. Okay, last week I haven't done yet. So okay, I tell you even if you don't have time to check your answers, all right, I don't know why you're so busy. I told you don't want to do the answer also, never mind. At least you read the answer scheme. At least download it first. Don't after I delete every time come, bothering me and also Cindy ask to send answer scheme. Just whatever we upload on the Google Classroom, please make it a habit to download it. Okay, and we have this year, surprisingly, we have a lot of students this year. So my Google Classroom is already locked already. My Google Classroom, okay, locked already. So I mean full house already. So whatever new student I add into a new classroom, so the classroom should have the same information. Okay, so download all the things inside. Okay, so that's the thing. All right, so I will okay, we do this. So now what I will do right now is okay, we will discuss whatever we stopped last week. So we go back to the slide. Okay. All right, so this is intensive course Form 4 chapter 10. Last week we have talked about everything about blood circulatory system. Everything. We talk about the blood, we talk about the vessel, we talk about the heart, we talk about the what do you call that? Blood clotting, we talk about the animals, blood circulatory system, how we do the algorithm, right? So all that we have mentioned already. So today we are going to the second part of this chapter, which is supposed to be short. So all this we have already, just give me a moment, we just go through it, you know, all this we have already done. Okay, all this already talked about it last week. Okay, you should have already read all this again. Okay, all this done. Okay. Alright, so today we are starting our lesson with lymphatic system, okay? So for lymphatic system, how many types of questions that they can ask you? So I'll call it as expected questions. How many types of questions that they can ask you in this chapter? Only 3 types. So you hanya boleh ada 3 jenis soalan sahaja. Satu is regarding formation of lymph ataupun pembentukan limfa. So this question, another type of question is formation of interstitial fluid ataupun formation of tissue fluid. Bendali tissue, that is another famous question. It's almost the same as this, okay? Another one is function of the lymphatic system, also very famous. And the last one is the disease of the lymphatic system, also very famous. So for lymphatic system, you will expect in your structured question ataupun essay question, you will see these 3 types of questions coming out, okay? So you must know this. So now we'll move on to the one simple picture before we go on to the basic theory, okay? So last week we understand that, you know, the artery actually brings the blood away from the heart. So imagine that the heart is over here, okay? So the artery actually brings the blood away from it, okay? And it's important for students to understand that we have a lot of body cells, and these body cells require nutrients and oxygen to survive, and at the same time, they need to excrete waste products. So the function of this artery basically is to bring all this oxygenated blood, you know, as well as nutrients to the cells, okay? But there is an issue. There is an issue. The issue is, if you have a look at this picture, the artery, the size of the artery is bigger than the capillary. So this is a big issue. So this is artery. Can anyone tell me what is this vessel called? Between the artery and the capillary, what is this vessel here called? Last week we have mentioned it. It's called the arteriole. Okay, it's called the arteriole. Okay, arteriole. So the issue right now is, based on the physics concept, pressure equals to F over A. As the blood goes from artery to arteriole to the blood capillary, the diameter that you can see is becoming smaller and smaller. So the area is becoming smaller and smaller, and as a result, you will have a very high pressure over here. A very high pressure over here. So you will have a very high pressure over here. So this tekanan is because of the decreasing in size of the lumen. Kita panggil ini sebagai tekanan hydrostatic pressure. Okay, so this hydrostatic pressure, what happens is we understand that in the blood, mostly is water. Am I right? 55% is plasma. 90% of plasma is water. So what happens is that this pressure will cause you see this yellow arrow, will cause the blood plasma to come out of the blood, to diffuse out of the capillary into the tissue space. So you can see that in between the cells, there are some space. So this space is what we call as tissue space. Okay, ataupun intercellular space. Okay, in bahasa Melayu, we just call this as rang antara sel. So you can see that the plasma darah akan meresap ke dalam rang di antara sel. Interstitial space nowadays they are not used anymore. I think your teacher don't know. Actually, in high level we prefer the word interstitial, but now they remove the word, they use with tissue. Okay, tissue space, tissue fluid. Right. So something that is important for you to understand is you must remember this yellow color fluid that is around the tissue. We call them as tissue fluid. Tissue fluid. Bahasa Melayu, bendale tissue. The only thing that you have to remember is tissue fluid was what? Tissue fluid was what? Just answer me, it's simple in the chat box. Based on what I described just now, tissue fluid was what? It was from the blood. It was from the blood. How come they come up? Because there's a high hydrostatic pressure. Not just pressure, Why? You cannot just say pressure, because pressure got many types in the body. You know? We got osmotic pressure, we got blood pressure, we got hydrostatic. This is called hydrostatic pressure. Okay? High hydrostatic pressure. So they come up. Why there's a high hydrostatic pressure? Because the artery is bigger than the capillary. Because of the size difference, you have a high pressure. Okay? So this tissue fluid, supposedly they should have the same component as in the blood. They should have the same component as in the blood. However, there are basically 3 things that you cannot find in the tissue fluid. So ada 3 benda yang tak boleh masuk dalam tissue, bendali tissue. And what are the 3 things? What are the 3 things that you cannot find in the tissue fluid? 1, sel darah merah, red blood cell. 2, platelet. 3, plasma protein atau protein plasma. So why these things can't come out? Because kita punya capillary setengah satu sel, they are too big, tak boleh lalu, too large, too big. So they get inside here. Am I clear? Okay, so this is tissue fluid. Alright. Masalahnya, what's the issue right now? The issue is, kalau semua plasma sudah masuk dalam kita punya rang di antara sel, what will happen? Your blood punya isi padu will become, the volume of the blood will become low. So how can the blood circulate around the body in this case? Faham tak? So maksudnya, tissue fluid yang dipaksa rela keluar, mesti masuk balik ke dalam darah or blood. So tissue fluid must go back to the blood. How many percent of the tissue fluid must go back to the blood? How many percent of the tissue fluid must go back to the blood? Answer me in the chat box. How many percent? The answer is yes, 100%. 100% of tissue fluid need to go back. Not 85, not 75. If you say 85%, maksudnya every time the blood pass through the cell, 15% akan terkumpul dekat situ. Tak boleh. 100% kena masuk balik ke dalam darah. I repeat, tissue fluid has to go back to the blood because they are buxar come out from the blood body. They need to go back. But how can they go back? Dua cara. Cara pertama, which majority of the tissue fluid does so, okay? More than 80% does this method. Di mana you tengok dekat sini. Okay? Actually, tissue fluid ini akan masuk balik kepada what we call as the venue end. Tempat ini adalah venue. Di antara blood capillary dengan vena is what we call as venue. So over here, the tissue fluid akan masuk balik. Kenapa? What process is this? Can anyone tell me what process is this? What process is this? Ini adalah osmosis. Thank you. Very good. This process is actually osmosis. Kenapa tiba-tiba osmosis berlaku? Simple. Imagine, just now at the arterial end, all the water come out already, isn't it? So the blood right now is very, very hypertonic. Sebab dia hanya tinggal red blood cell, tinggal platelet, tinggal plasma protein. So the blood is very pekat. This blood is very pekat. So when they reach the venous end, dia adalah hypertonic terhadap tissue fluid. That's why the water will go back into the venue end secara osmosis. Faham tak? It's all because of osmosis. Because the tissue fluid dia adalah hypotonic terhadap darah dekat venue end. Hujung venue. So it's osmosis. And this is majority. About 85% do this. Tapi kita dah 100%. Kita dah 100%, bukan just 85%. So the remaining 15% macam mana? So the remaining 15% kena masuk dalam sistem limfatik. So you see this is another arrow. Dia masuk into this thing. So here you can see that actually the function of the lymphatic system, the number one function of the lymphatic system is to memulangkan bendale tissue kembali ke darah. The excessive ones. Why do you need to do that? Kalau you tak mengembalikan the bendale tissue balik, what will happen? Number one, your blood punya isi pandu will become less. Number two, the blood pressure also become less. Number three, your body will jadi bengkak sebab tissue fluid tu semua accumulate. Do you get me so far? Okay, so if you have a look at your notes, I actually prepared a mind map for you. A mind map. So this is how we are going to answer in the exam dalam penghasilan the lympha. Okay. So number one, we must tell that the blood that enters the arterial end is under high hydrostatic pressure. So you mesti kena cakap darah yang masuk dalam hujung arterial mengalami tekanan hidrostatik yang tinggi. Okay, this is always number one. Kalau you adalah student yang sangat hebat, you must give reason. Kenapa? I don't want to mention it again. So you should know why. Kenapa the blood is under high hydrostatic pressure? The concept is very simple. Sebab your size of the artery is bigger than the blood capillary. That's all. It's a size difference. Betul tak? The lumen. So lepas tu, what happened? So they will force some of the blood plasma to diffuse out of the blood capillaries into the tissue space. So memaksa is memang dipaksa to come out sebahagian dari blood plasma darah untuk meresap keluar dari capillary darah ke dalam ruang antara sel. So this akan form the tissue fluid ataupun bendale tissue. So you must understand two things about this tissue fluid. Number one is the component. Bila kita nak terangkan komponen dalam bendale tissue, you must first tell dia ada semua komponen di dalam darah kecuali except these three things. So we say they are the same as the blood, but they don't have RBC, no platelet, no plasma protein. These three things you must remember. And the reason is because they are too large. Terlalu besar untuk keluar dari capillary darah. And number two, you must know the function. So apakah fungsi limfa? What's the function? Are they really stupid, no function at all? No. We call them as a medium for exchange of substance. Complement blood circulatory system is a function of lymphatic system. So this is something very important, It's regarding answering technique. Dalam peperiksaan, you kena tengok betul-betul. Are they asking you function of lymphatic system or function of tissue fluid? Now I'm talking about function of tissue fluid, not lymphatic system. Function of tissue fluid. So this tissue fluid yang tadi keluar tu, function or not? God, what they do? They are the medium for exchange of substance. Maksudnya, kalau, okay, what does this mean? Exchange of substance between blood and cell. What does it mean? So, if oxygen wants to get in from the blood to the cell, dia kena lalu tissue fluid lah. So the tissue fluid, walaupun dia adalah fluid, is like a jambatan like that lah. Kena, it connects the blood to the cell. So the thing can pass through easily. Kalau tak, how they want to jump across? Takkan they just vacuum, right? Cannot lah. Imagine there's no tissue fluid, what will be there? Empty. So how they want to go across? Tak boleh. So at least now they allow diffusion. Faham? So the function of the tissue fluid is to allow exchange of substance between the blood and the cell. So macam mana kami boleh elaborate benda ini is that you need to tell, okay, you need to tell what are the substances you're talking about. What are the substances? Substances, we can always divide into two groups. The useful ones and the waste products. So useful ones, contoh, like our nutrients, okay, ataupun our oxygen, okay, direction is from the blood to the cell. And then importantly, you must add the keyword. The keyword is through the tissue fluid. This is a keyword. Maksudnya it's like, a medium to allow the exchange. And another one, of course, is our waste products like carbon dioxide, urea. So the direction is from the cell to the blood. Of course, also through the tissue fluid. That's the function of tissue fluid. This question pernah keluar a few years back for SPM. Students all mati. Sebab dia ingat they ask function for lymphatic system. Ini bukan function of lymphatic system. It's a different thing. Okay? It's a function of tissue fluid. So you must understand that, okay, tissue fluid must go back to the blood. They must go back to the blood. Okay? 100% of them must go back. So how many methods just I mentioned? Two methods. Majority of them do what method? Tell me in the chat box again. Revise. What majority? What they do? Osmosis. Dekat mana? Osmosis dekat venue end. Am I right? So this is majority of them. Majority, I would say around 85% they do this. Re-enter the venue end through osmosis. This is the most common method. Another method, they will go into the lymph capillary and become the lymph. This one how many percent? About 15%. Okay, so as usual, we don't have the luxury of time for you to slowly copy because I know I just give you a blank space, so it might be difficult to copy. Watch the recording later. Okay, watch the recording. I give you one more week to watch, so you can actually copy down the thing later because I don't want to waste time. Today we need to finish up chapter 11 also. Alright, so okay, but most importantly, at this point, do you understand or you don't understand? Okay, so I need to emphasize to you is that this question ada dua variety. One type is they ask you the formation of tissue fluid sahaja. Kalau dia hanya tanya pasal formation of tissue fluid, you only reach here only lah your essay. Hanya reach here. Biasanya untuk formation of tissue fluid, you need to also write the component. Dia ada dalam answer scheme biasanya. So this whole thing 1, 2, 3, 4, 5. Kalau dia tanya pasal formation of lymph, you extend the essay until you talk about here. This one extra sentence. Are you clear? Are you clear? If you're clear, write number 1 in the chat box, let me know. I'll move on to the next part. Okay. So now we will just have a pretty look at the structure of the lymphatic system. So the structure of the lymphatic system always start with the, kalau dalam sistem peredaran darah, we talk about capillary darah. So in system lymphatic, we talk about what? Capillary lympha. Lymph capillary. Okay, so lymph capillary is this thing. This is called lymph capillary. So dalam peperiksaan, how do we differentiate between blood capillary and lymph capillary? Sebab in your exam, all these will be colorless. Dia tak ada warna kan? So how you want to differentiate? Actually, it's very easy. You can see that in blood circulatory system, semua, you know, these vessels are connected. Tapi for lymphatic system, they are close-ended. So kalau you nampak, dia macam, you know, hujung dia ketutup, that will be our system lympha. That is how we see. Dia tak connected dengan benda lain. Okay, so this is what we call as lymph capillary. Alright. So this lymph capillary nanti dia akan bawa. Okay, remember whatever. So now we got 3 fluid. Understand? We got the blood inside the blood vessel. We got the tissue fluid around the cell, and we have the lymph in the lymphatic system. So these 3 things, they are more or less the same, but they are different. Same but different. These 3 things: blood, tissue fluid, and lymph. They are different. Number 1 is the location. Location memang different. Satu dalam darah, which is the blood. Okay. Satu dalam ruang antara sel, which is the tissue fluid. One more is lympha, which is in the lymphatic system. So location is different, and the content is also different. Little top of it. Okay. So from here, dia akan pergi masuk dalam lymphatic vessel. Lymphatic vessel is a bigger vessel. Macam kita punya artery like that. Okay, bigger. From the lymphatic vessel, dia akan go to 2 places. Sama ada right lymphatic duct ataupun thoracic duct based on which part of your body are you talking about. So if I draw a human, okay, so this is a human, gingerbread human. Okay, biasanya we divide from the torso half like this. So half of the head until half of the waist. Okay, so this part, which is the right side of the body, okay, kalau from all this part of cell, dia punya lympha eventually akan masuk kepada right lymphatic duct. So all this, whatever from this body part, they will masuk into your right lymphatic duct. And the rest of the body that I never label anything, they will all masuk into thoracic duct. So thoracic duct, they actually bring the most lymph in your body. So the thoracic duct is the biggest lymphatic vessel in the body. Faham? Okay, so from the thoracic duct and from the right lymphatic duct, they will masuk, if it's right lymphatic duct, they masuk into something called right subclavian vein. Kalau thoracic duct, they move to left subclavian vein. So right subclavian vein, okay, why is it called subclavian? Sebab dia di bawah clavicle. Sub maksudnya di bawah. Alright, so right subclavian vein means it's a vein that goes below the clavicle. That's where the right lymphatic duct empties the lymph into. Okay, and importantly, you need to remember, okay, from the ducts, you go back to a vein. So what does it mean? What does it mean? That means this right subclavian vein, does it belong to lymphatic system? Right subclavian vein, does it belong to lymphatic system? What system does it belong to? What system does it belong to? The blood circulatory system, BCS. So by doing so, it means that your lymph has successfully returned back to the blood. Your lymph has successfully returned back to your blood. Okay? Alright? I'll show you one picture. Okay, so this is the picture. Basically showing you a few things about lymphatic system. Number 1 is that you need to understand all these green lines. I expect all these to be lymphatic vessels. All these are lymphatic vessels. Okay, all these are lymphatic vessels. So kalau this one is right hand or left hand of the person. Right hand or left hand of the person. Right. So from the cell they go into the lymph capillary. From the lymph capillary they masuk into this lymphatic vessel, betul tak? So all of these they will go where? They will go to this final destination. Nama dia adalah right lymphatic duct, which is over here. And from this right lymphatic duct, they will masukkan the lympha into this subclavian vein. Yang this biru punya benda. This is your right subclavian vein. This is how they return the lymph to the blood, which is the number 1 function of lymphatic system. Kalau from the rest of the body, I'm talking about from here, from your legs, or from your legs all the way left side of the body, they all will go into this place called the thoracic duct. Sini right lymphatic duct, dekat tepi ini left, it's called thoracic duct, ductus thorax. From there, they go into your left subclavian vein, and eventually they enter into the vena cava, then enter into the heart. Okay, so besides the lymphatic vessels, it's important for you to know there are a few more things that belong to lymphatic system. Contoh adalah lymph nodes. Okay, lymph nodes, nodus lympha. So these lymph nodes, okay, what they do is that they produce a very important white blood cell in the body called lymphocyte. Lymphocyte, we studied this last week, right? So you can see the word lymphocyte, lymph nodes, you know, it has to do. So lymphocyte is produced by the lymph nodes. Can you tell me what's the function of lymphocyte? Please don't disappoint me because we have talked about it last week. What they do? Lymphocyte, what they do? They produce antibodies, betul. So to fight antigens lah, okay? So this is also another important function of the lymph nodes. So that's why we say, okay, the lymphatic system, second function, so one, they return the lymph back to the blood, isn't it? So number 2 is what? Number 2 is they can also provide pertahanan untuk badan. Pertahanan. Later you know in chapter 11, this is which line of defense? Third line. Sebab dia ada nodus lympha, the lymph nodes to produce lymphocyte, which can produce antibodies to fight infections. These lymph nodes, you cannot find them all the places, but there are some places that have a lot of them, like in the neck, okay, in some part of the armpit, right, some part of the legs, in inguinal region, you see a lot of these are lymph nodes. Okay, another part that sometimes they come up in objective question is a part called spleen. Spleen is an organ behind your stomach. So this spleen, okay, in Bahasa Melayu is called limpa. Okay, it's called limpa. Also is a lymphatic organ. Thymus, present only in children. Usually for adult, it is already disintegrated. You don't have this anymore. Usually, that is your thymus. Okay, usually we don't have it as a adult, but for some patients with some disease, you will have the mass over here. That is abnormal. Okay, and then your tonsils. Okay, tonsils also belong to it, right? Thymus, in reality, what it does is it produces an antibody. It's where an antibody it's where the cell called the T cell matured in. So we have two types. It's actually in your syllabus, but it's not in your syllabus. In chapter 11, you know that lymphocyte actually got two types. You know, BTS, but no S, B and T. So lymphocyte got two types, cell B and cell T. Okay, cell T. Why is it called cell T? It's because this cell are matured from thymus. The T is from here, T cell. Why you know about T cell? Because T cell is the one that HIV target. This is chapter 11. Later I'll go through it again. But for adult, normally we don't have thymus anymore. It's really degenerated. Okay. So your tonsils, all those belong to your lymphatic system. Okay. B cell of the lymphocyte, B cell, the B comes from bone marrow. They mature in the bone marrow. B cell. We don't need the thymus to mature. They can mature in the peripheral blood. Don't forget, blood cells are produced by the bone marrow. It's the place that mature actually. Okay. So one more function I want to bring your attention to is to the intestine. Okay, I want to bring your attention to the intestine. So in the intestine, specifically ileum, kita ada banyak, finger-like projections. Do you remember? Kalau saya lukis satu, okay, I draw one. Okay. So what is this thing in the middle called? What is this thing in the middle called? Lectule. Betul tak? Lectule. I pernah tell you this before. Do you see this lectule? You see this lectule? Dia ada hujung yang tertutup. So what is it actually? What is actually a lectule? Tell me in the chat box. What is actually a lectule? You see the lectule? They have a closed end, isn't it? What is a lectule? It's actually a capillary lympha. It's a lymphatic capillary. So that's why I told you, for lectule, you have to remember L stands for two things. One is what? What is lectule? Now one is lipid. So lectule ni, dia akan absorb semua benda yang ada kaitan dengan lipid. For example, like lipid ataupun kita punya vitamin larut lipid, ADEK, dia masuk into lectule. Two is lectule is actually a part of your lymphatic system. So when we talk about functions of lymphatic system, ada berapa? Based on the picture I show you, this picture, how many functions of lymphatic system are there? Berapa? 3. You are right. 3. Satu is here. Return the excessive tissue fluid back to the blood. So we say that dia adalah pelengkap kepada sistem peredaran darah. It's a complement to the blood circulatory system. Sebab kalau tak, your blood will be low volume, low pressure. 2, this is number 1. 2, kita ada lymph nodes yang boleh menghasilkan lymphocyte, yang boleh menghasilkan antibody untuk pertahanan badan. That's number 2. Number 3, dalam kita punya usus, we have lectule yang boleh menyerap dan mengangkut lipid. 1, 2, 3. Simple as that. So as a conclusion to what I say, I give you the functions in words. Dalam your notes, I think in your notes, I make it like an essay. Kalau tak silap, I make it like an essay. So you don't have to copy it again, you just fill in the essay. Itu je. Dalam your notes. I forgot which questions already, but I make it into a notes. I make it into an essay form. So this essay, if it comes up 6 marks, memang senang gila nak mampus. Because 6 marks means you need 3 points, each point 2 marks. Very easy. Very easy. So Alan, any questions? This is the second type of expected question that you can expect, which is what we call as lymphatic system function. Boleh? Okay, I go on to the third type of questions. What, such if the spleen is swollen, does it mean that the body faces a high risk of infection? Why is the spleen swollen? I have seen this question in the exam before. The one who asked this question is stupid. You're not the one who asked this question, right? You have seen this question somewhere before. Okay? So the person who asked this question is stupid. Splenomegaly, that's what we call in medical terms, has so many reasons. Okay? And you cannot say whether the spleen big means you have high risk of infection. No, it's not like that. Depends on the cause. Okay? Because you need to understand, your spleen. Okay? Your spleen, dia ada dua function. One is it is part of lymphatic system, betul? Lymphatic system. Okay? So you can argue that when your spleen become enlarged, jadi besar. When your spleen jadi besar, maksudnya supposedly you are very active. Meaning you will produce more lymphocyte. You can actually you can actually defend your body more, things like that. Okay? Defend your body more. So your chance of infection becomes reduced. This, I think, is the correct answer for your syllabus, which I think is not correct in reality. In reality, you don't forget another function of the spleen. Who can tell me another function of the spleen that is related to the blood circulatory system I mentioned last week? Is to destroy blood cell. You're right. Not only RBC. The spleen can destroy all blood cell, including platelet and also white blood cell. Dia adalah terminator for blood cell, damaged blood cell. Okay? This is in reality. In reality, when your spleen become very big, what happens is that when the blood cell pass through it, they will get destroyed. So as a result, you get lesser white blood cell, and your chance to get infection will be higher. That's why in patients with splenomegaly, especially thalassemia patient, we will need to remove the spleen. Right. But based on your answer, I think your teacher level haven't reached there yet, so they will talk about this. The chance of infection is reduced because it's active, something like that. But that's not true in reality. All in all, you have to depend on the underlying cause of it. So this question to me, I think, is not logic in reality. Ruptured spleen is okay. Can you live without a spleen? My question, can you live without a spleen? Can you live without a spleen? Answer me. Yes, you can live without a spleen. You don't need a spleen. You don't need a spleen. Seriously, you don't need a spleen. You can live without a spleen. But you need to get vaccine for certain infections. That's all. They'll be more prone to certain infections. So you get vaccinated to that. That's all. Okay? So, next we talk about disease. Okay, we talk about disease. So disease-wise, okay, you only have one disease in your syllabus. We call that as the what? Edema. Okay, edema. So what's the meaning of edema? Edema maksudnya you have too much of tissue fluid around the cells. Too much of tissue fluid around the cells causing swelling of tissues. So these three things must have in your essay or short question. You must talk about name of the disease, kenapa dia jadi, and what's the effect. So name of the disease, kenapa dia jadi, and the effect. These three things must have in your syllabus. The next thing that I might ask you is punca. So what causes edema? Of course, edema can be caused by parasite infection. Kalau dia caused by parasite, we call this as lymphatic filariasis. Okay, we call it as lymphatic filariasis. The worm is called the filarial worm. Okay, this disease is transmitted by mosquito. It's a mosquito-borne disease. Alright, but the one that caused the infection is the parasite, which is inside the mosquito. This is caused by mosquito. I've seen this come out in objective question before. Students just start. It's mosquito-borne disease. The thing is, in lymphatic filariasis, what happens is that the parasite, they block the lymph vessel. When they block the lymph vessel, the lymph tak boleh balik, so it causes a traffic jam. Your tissue fluid all accumulates there and you get swelling. That is called lymphatic filariasis. Faham? Another one is the person is bedridden for a long time. Kenapa bedridden will have effect? Sebab the way the lymph flow back to the heart, to the blood, is the same as how the blood flows in the vein. Kalian masih ingat what I told you last week? They depend on contraction of skeletal muscles, otot rangka in the leg. So if you are bedridden, you're not moving, there is nothing to pump, contract and relax to pump the lymph back to the blood, so they accumulate there. That's why it explains bedridden. Pregnancy mostly is because of compression. Baby is a big compression. Baby can compress on your lymphatic vessel, and you cause a traffic jam, you get swelling over your legs. Next one is deficiency of plasma protein. What plasma protein especially are we dealing with? Which plasma protein? Albumin. You're right. Why a lack of albumin can cause swelling? The reason does not relate to the lymphatic system. It's more to the blood system. Okay, I told you before, albumin maintains the blood osmotic pressure. Okay, so kalau you have a decrease in albumin, what it means that your blood is less concentrated. Your blood is less concentrated. Maksudnya your blood now becomes hypotonic. Hypotonic. Am I right? So just now, if you remember, dekat venue end, the way the tissue fluid go back is by osmosis. That means they need the blood to be very hypertonic dekat hujung venue. Baru dia boleh menyerap balik dengan osmosis. Am I right? But now, because of lack of plasma protein, the blood is not so pekat. Difficult for the tissue fluid to come back. As a result, the tissue fluid accumulates around the cell and you get edema. So that's the reason of this. Nothing really to do with lymphatic system. It's because it produces too much tissue fluid. They cannot go back. Understand? Are you okay? Alright, full stop. Settled. Soalan? Questions? Alright, if you have any question, you can ask. If no question, you just type a letter 1 in the chat box and I'll move on to chapter 11. Which would be the least severe case of edema? Each of them has a disease. Wait, what is less severe cause? In fact, is edema really a name of disease? Or is a sign? Edema is never a disease. In reality. In your syllabus, they call this as a disease. But in our medical term, this is not a disease. This is just a sign. If someone has an edema, there's something that causes it. And you need to solve the underlying problem. Not to treat the leg bengkak. Okay. When we're pregnant, we produce much more tissue fluid. In reality, maybe, because your blood volume will increase when you get pregnant. So when your blood volume increases, you got more tissue fluid production. That is because you want to nourish your baby. That is another reason why you can get edema when you are, pregnant. Is edema dangerous? Once again, edema bukan satu penyakit. Edema adalah satu sign. Maksudnya dia, okay, is fever a disease? Is fever a disease? Is fever a disease? No, right? When you have fever, do I just treat your fever? If I do like that, means I'm a lousy doctor, which, sorry to say, majority of the GP does that. There must be a cause for your fever, right? So now you're asking me, is edema dangerous? I'm going to ask you, is fever dangerous? Sing. Is fever dangerous? No. Fever is not dangerous. Fever is not dangerous. Are you serious? So, it can be, right? So it depends on what causing it. You understand? So you cannot ask me, is edema dangerous? Because edema, macam fever is a sign. You don't solve the thing, you need to find out what causes it. And that cause can be dangerous. Faham? Can a cancer patient have edema? Can a cancer patient have edema? Can. Why? Macam mana? How come? How can a cancer patient have edema? How? Chemo? No. Mast cell don't work? No. Can cancer spread? Can cancer cells spread? Can cancer spread through lymph? Yeah, definitely lah. I I've seen a patient with breast cancer, the whole hand is burnt out. So you ask me, edema dangerous or not? Depends lah. Depends what's the cause lah. If it's pregnancy causing edema, dangerous or not? Dangerous or not? If you're pregnant, you're having edema, dangerous or not? Depends. Also depends. So it really depends. This page has no meaning in medicine. In Form 5, it seems like something very bombastic. But for us, this page has no meaning actually. Of course lah, why cancer cell cannot block? If a parasite can block, you think cancer cell cannot block? What do you mean in the brain also can block? What do you mean in the brain also can block? Cancer block in the brain is an organ. If you have a blockage, you are blocking what? Are you blocking vessels or blocking lymph? You understand what I'm talking about right now? Okay. So let me ask you, Sachif, will cancer cells block in cerebral artery? Your artery flows so fast. You think they got time to stuck there, man? Okay. Settle. Alright. So this is we talked about this already also. Okay, done. So any questions? I hope there's not. Okay. Now we move on to chapter 11. Okay, Joe. We have another 1 hour left. Hopefully we can finish it. Okay. So in this chapter 11, we are going to keep things very simple and short. Okay. So there are only 2 things you need to know. Number 1 is about barisan pertahanan or your body defense mechanism. Okay. So when we talk about the body defense, you must know we have 3 lines. So we have first line, we have second line, and we have third line. Betul? Okay. First line and second line, they have one similarity. Dia ada satu persamaan yang sangat penting, in which both of them are not specific. This is important. Okay, I repeat. Okay. So both your first and second line, they are not specific. Apakah maksud not specific? What's the meaning? Meaning you cannot actually differentiate between specific pathogens. Maksudnya your first line and second line, they don't know whether this is a dengue virus, or this is a COVID virus, or this is a parasite, or this is a bacteria. They cannot differentiate. All they do is they just block only. They don't know what is what. Okay, that's the meaning of tidak specific. Whereas your third line of defense is the only line of defense and the best line of defense that is specific. Maksudnya dia boleh identify specific pathogens, very specific. So COVID dengan dengue are different thing. Walaupun dua-dua adalah virus, but they are different. So this is very, very important. Which one is your immune system? Are all the trees belong to immune system? System keimunan. Are all 3 of them system keimunan? Are all these immune system? Answer me. The answer is no. Only third line is your system keimunan or your immune system. Your first and second, they are not immune system. Understand or not? But are they defense? So in your exam, you have to see carefully. Are they asking you on immune or asking you on defense? If it's defense, then we talk about first, second, third. If it's immune, then it's third. So you see carefully. Bukan semua ini adalah sistem keimunan. Sistem keimunan is only third line and is marked by specificity. Okay? So we go line by line. We start with first line first. Okay? So we start with the first line first. When we talk first line of defense, we must know the components. Okay? We must know the components. The important thing is, okay, when we talk about components, there are altogether 6 of them. 6 of them, importantly, 6 of them. Okay? And the key word is lysozyme. Lysozyme, which is an enzyme to break down all the shake. Okay, so we have 6 of them, so we have the scheme. Okay? The way for me to remember first line of defense is, how can a pathogen enter your body? Can you tell me, from where the pathogen can enter your body? How? How can a pathogen pass into your body? Number 1, maybe through your skin. Number 2, where else? From a wound, okay, possible from a wound. What else? Besides, okay, from your eyes, from your ears, from your nose, from your mouth. So that means all these are the places that should have the defense of first line. That's how you remember. It's the first entrance point. How can they enter your body? So skin. So how can your skin be a first line? Sebab dia adalah pelindung fizikal dengan kimia. So again, you have your physics, chemistry, bio. Your skin is a biology system, tapi dia adalah physics dengan kimia. Physics means dia memang adalah satu impermeable barrier. In bahasa Melayu kita panggil dia sebagai tidak telap. So if you mandi and everything, the water won't go in. It's memang impermeable, so nothing can go in. Physical barrier. Chemical barrier maksudnya kita ada peluh dan juga sebum. So how you want to relate this? You know, how you want to relate these two? Okay, with first line of defense is that keyword lysozyme. Dia ada lysozyme. Of course, sebum adalah minyak, is oil. So it can also prevent the growth of pathogens. Okay, pathogens sebab dia tak boleh buat aerobic respiration. So first line of defense. Remember, when we talk about kuman-kuman, we always use the word pathogen. Bahasa Melayu, pathogen. Don't use words like bacteria, virus. Itu sangat-sangat baby level. We use the word pathogen. Pathogen adalah whatever can cause disease. That's word. Okay? So just now you tell me, it can be the skin, right? Which can have physical and chemical barrier. Apa lagi? Just now, what else can go in? They can go to your mouth, nose, and all that, right? So that's why, if you use your finger and you take your nose right now, you put your finger inside your nose, what are you touching? Don't tell me nose hair. Your nose hair is on something. What are you touching? When you put your finger in your nose, what are you touching? We call it as mucous membrane. Benda itu adalah mucous membrane. Mucous membrane, dia melapisi organ dalaman ataupun kita punya salur dalaman, from your nose to your lungs, from your mouth to your ass, from your penis all the way up. Okay, so your internal tract is mucous membrane. So mucous membrane, what they do? What they do? Definitely, they produce mucus. That's the function. They produce mucus. So if I ask you how you want to describe an exam, how does mucus defend the body? How does mucus defend the body? What's the word that you want to use? Trap. Okay, trap already. So keyword lysozyme. So whatever this first line you just say the lysozyme to digest the pathogen. That's all. Faham tak? Okay, so 1, 2. So just now some of you tell me can be from the eyes. So in the eyes, what is in your eyes? You have tears, eye matter. In your mouth, what you have? You have saliva. Fair enough. So again, how does this defend the body? How does this defend the body? Lysozyme. Lysozyme. Digest pathogens. Then just now, some of you say, okay, your mouth, maybe the saliva couldn't destroy them, then how? They get swallowed into your stomach. Then, remember back what we learned in chapter 9, what we have in the stomach? We have hydrochloric acid. Hydrochloric acid can also destroy the pathogen. But is this related to lysozyme? Is hydrochloric acid related to lysozyme? No, this is pure because of its low pH, ataupun high acidity. Then just now some of you tell me, can muscle through your wound. That's why last week we studied about pembekuan darah or blood clotting. And why is this so important? Because when you form a clot, you prevent blood loss, you prevent entry of pathogens. So is this has to do with lysozyme? No, this is purely physical barrier, pelindung physical. Keyword, DSA. What is DSA? What is DSA? Dr. Steven algorithm. Okay, at least you write the full name DSA. Key point, lysozyme. So all these you can write lysozyme kecuali don't write for hyaluronic acid and this. These two no need. Lain semua boleh pakai lysozyme. Easy je. This question, will it come out in exam? Students ask me, will first line of defense come out in exam? The answer is yes. If you did trial last year, got about 2 states, came up. This year, I don't know. I haven't really seen the trial this year. But when you already did the trial, I don't know. Only a few of you texted me your result. So you get like 90 plus. Very good. I mean, even though I say I don't care your trial, doesn't mean like, you don't have to inform lah. I just inform a bit only. Okay? It's okay, never mind. Okay? Can first line of defense. Settle. Any question? Oh, Sinning 88, congratulations. That's great. Okay, so in exam you will get A plus. Okay, in SPM you get 88, definitely is A plus already because SPM follow graph one. SPM equal graph. Graph cannot be 90 A plus 1. Understand? Okay? So you just expect, you are different than other people. Those who go out, they study themselves, definitely they cannot answer some of the questions like you. They just memorize and they memorize sure die on the exam. Okay, so believe in yourself. Congratulations, Sri. Wow, okay, good sign. Okay, very good, very good. Okay. So now we talk about second line of defense. Okay, so first line done already. Now we move on to second line of defense. Second line of defense, you need to know what I call as Dr. Steven triangle. A lot of things. There's a triangle here that you have to know. So this triangle actually are the components of second line of defense. So the first component is fever. Okay, so fever is defined by body temperature higher than 37 degrees Celsius. We call it as a fever. Okay, another component is inflammation. We call it as keradangan. So you just have to imagine when you sakit tekak, that is an inflammation of your throat. Okay, what will happen when you have a swollen throat? What will happen when I come and open your mouth? I shine light. What can I see? Doctor always asks you, what do you see? You see red color. So redness is one sign of inflammation. Red, number 1. Number 2, you will get swollen. Bengkak. The throat become bengkak. Am I right? Swelling. Number 3, most importantly, why you go and see the doctor? Why you go and see the doctor? Because of pain. Sakit. And of course, the throat you cannot go and touch. If it's inflammation in other part of your body, you normally will get warm. So this is the one I'm talking about. Okay, red, warm, pain, swollen. Warm also here. When you touch it, it feels hotter than usual. I believe all of you have got inflammation in your skin or what. You touch it, you feel it's more hot than usual. So phagocytosis is number 3. Why do I call this as Dr. Steven triangle? What it means is actually your fever and your inflammation, both of these is to help your phagocytosis. Maksudnya, your key player is phagocytosis. Maksudnya, if you ask me, okay, why do we need to have fever? In exam, if I ask you, kenapa kita nak buat fever? Okay, again, fever, this one is a bit mistake. I put 37, it should be 37.5. I don't know why I put 37. 37.5 degrees Celsius. Okay, not 35. 37.5 degrees Celsius. Okay, so when you have got a fever, all right, if I ask you an exam, what is it for? Your job is to actually enhance your phagocytosis. All right, inflammation, the main purpose is to enhance phagocytosis. So what is phagocytosis? You must know the player that we talked about last week. Last week, remember or not? We have what we call as phagocytes. Phagocytes, what are phagocytes? Phagocytes adalah sel darah putih yang melakukan phagocytosis. And tell me in the chat box, who are the two? Who are the two fella that perform phagocytosis? Who? Neutrophil dengan monocyte. Betul. Macrophage, don't write. Macrophage is actually monocyte. Macrophage is monocyte apabila monocyte jadi besar. So it's your neutrophil dengan monocyte. Masih ingat macam mana differentiate their appearance? How you want to differentiate neutrophil dengan monocyte dalam peperiksaan in the exam? How you want to see? Kalau neutrophil, dia ada 3 ke 5 nucleus bercuping. Okay? Monocyte, nucleus looks like a bean, usually. So what they do? They usually engulf and digest pathogens. Okay? This is a key point that you want to talk about. Mengepung dan mencerna pathogen. Okay, so this is a mind map. I believe I have a handwritten note for you, isn't it? I handwritten the note, I put it horizontal in a landscape mode. You saw, no? So you don't have to copy everything again, you use that. Okay, that is my handwritten notes. That's my handwriting, by the way. Okay, so I make it easier for you not to copy so difficult. Okay, so done. Next. So, first of all, we talk about inflammation first. Fever, nothing to talk about. Fever is just when your body temperature more than 37.5. More than 37.5, you have fever. Why you need a fever? Because it improves phagocytosis. Your phagocytes get more hype up when the temperature is a bit hot. Okay, so you heat them up, they become faster. Now, the issue is inflammation. And this question come out in the exam. Very often lately, sangat kerap. Soalan ni keluar dalam peperiksaan memang sangat kerap. If you see in trial 2023, last year punya, it came out for a few states. I think at least 2 to 3 states keluar. Keradangan, ask you to explain what happened. This year, I'm not sure any one of your school keluar this as your essay. Kalau dia keluar, dia akan jadi soalan essay. Ask you to describe about inflammation. So first of all, you need to you need to understand something first. In inflammation, what are the 4 things I said just now that will happen? Satu, you become red. 2, it becomes swollen. 3, you will become warm. And last, you become pain, right? I told you. Right now. So all of these have reasons behind. But, okay, we talk about this first. So now what happened is, okay, in inflammation, in your syllabus, we assume that you got an external wound. For example, someone accidentally stepped on a nail. Paku. Okay? So you can see there is a wound over here. When you have an injury, okay, when you have a local injury, these tissue that are dying, you can see they release all these things. This thing is very important to know. And remember, nama benda ni adalah histamine. All this. Histamine. Histamine. Okay? These are called histamine. So, initially, you have to understand that your macrophage, usually in the cell, we don't call them macrophage, we call them as monocytes sebenarnya. Kalau dalam darah, we call them as monocytes sebenarnya. Okay? So, these monocytes, they're just going around the blood, they're just going around the blood. When you have histamine, they start to go into your blood vessel later. Okay? So, when they go to your blood vessel later, they will cause 2 things to happen. Histamine cause how many things to happen? Please, this is very important. Histamine cause how many things to happen? How many things to happen? I mentioned how many things to happen? Histamine. 2 things. You must remember 2 things. There are 2 things that happen. 2 things. Number 1, you can see what happened to the vessel. What happened to the vessel size? It becomes dilated. So kita panggil ini sebagai pemvasodilatan ataupun vasodilation. So jadi mengembang. The salur darah menjadi mengembang. Why? Who can tell me the reason? Why they need to become vasodilated? Why? When you vasodilate, sama macam, no, this is nothing to do with telap. You don't confuse. Vasodilatation has nothing to do with permeability. This is very good. It's to increase blood flow. You need to recruit soldier. You have an enemy right now. You want to recruit soldier. So what happens is that definitely you need to vasodilate so you get more blood cells. So more blood cells will come out. This is to increase blood flow. Meningkatkan aliran darah. Then number 2, look at the capillary punya cell. What happened to them? Initially they stick together, isn't it? Now what happened? You see there is a gap between them already. This is what we call as increased permeability ataupun meningkatkan ketelapan. Why? It's easier for the cells to come out. So what we want to come out? What we want to come out? 2 things. Number 1, we want the phagocytes, and number 2, we want the clotting factors to come out. 1, phagocyte. 2, clotting factor. So what will happen? After they come out, what will happen? Phagocyte will do its job lah. You see what is it doing? What is it doing? What is this further doing right now? Phagocytosis. Then, factor pembeku, you got a wound right now, isn't it? You want to stop the pathogens from muscle. What do you need to do? What do you need to do? You need to do blood clotting. Settle. This is inflammation. Easy, very easy. So inflammation, you see how many words I have in my paper? Histamine, 1, 2, 3, 4, 5, 6, 7, 8, 9. Less than 10 words. So it's very easy. Again, this one I can give you a picture in my notes, I believe. Okay. What it means is very easy actually. When you got an injury, the tissue will release histamine. Okay. So this histamine, they will cause 2 things. 1, vasodilation, increase blood flow, so that more cells can come. Number 2, increase permeability. So even though they come, they must be able to go up. Go up. What needs to go up? 2 things. Phagocyte, clotting factors. Phagocyte do phagocytosis. Clotting factors do blood clotting. Hey, students. So inflammation is actually for what? Inflammation is actually for what? For phagocytosis. So that's why my triangle is like that. So why is the place that is inflamed is red? Sebab more blood flow. Why is it swollen? Because you got more things comes out and do all this active fighting. It's a war zone. This is a war zone, man. Why is it warm? More blood flow. More heat loss. Why is it painful? Because they will release a lot of chemical mediators that you don't study in your syllabus right now. Okay? Done. This is inflammation. If this question comes out in exam, can you write? Do you want me to write, like, treat you like a baby, write a full essay? I don't think you need. If you understand all this keyword, you write this keyword in your essay, definitely you get full marks. Okay? Move on. So this is second type of question. Important also, can come out in essay. Is how does phagocytosis happen? This one even more easy because it's the same essay as in amoeba. Remember, we talked about amoeba in first class. Intensive course 1, we talked about amoeba, right? Remember? So in phagocytosis, the essay is the same. So what happened? Number 1, they need to approach first. They have to approach the pathogen. So this thing have to go near it, like what you see in this picture. Right? From the blood, they have to come out and then they need to go approach it, go near it. So after they approach it, number 2, they need to, can you see the hand? So-called hand, pseudopodia. What happened to the pseudopodia? They will extend. Extend pseudopodia. So why they extend pseudopodia? To do the action of engulf. These are all the keywords that we want to see. So after they successfully engulf this further, in amoeba, we call this as vacuole makanan or food vacuole because for amoeba, it's a food. But for phagocytosis, this is a pathogen. So we don't call this as food vacuole. We call this as phagosome. Maksudnya apa? What is phagosome? Maksudnya, this is actually, phago means what you eat. Som means, lysosome is a sphere. It's basically a sphere that contains whatever you eat. So it's called phagosome. So you can see in the next picture, what happened is, this green thing, they start to bind with your phagosome. And that is called lysosome. This is lysosome. So lysosome fuses with your phagosome. Okay? And this whole thing, we can call this as a phagolysosome. This whole thing. And later on, your lysozyme, in picture number 3, will digest the pathogens. That's what it does. And last but not least, you can see from the waste products will get excreted. Once again, in my essay, I got give you one essay question on this. This is how we should fill in the blanks. In biology, you really need to visualize the process. Understand how it really happens. That's why I will show you pictures a lot, not words. Our brain is not designed to memorize words, but pictures. Right now, ancient times ago, million years ago, okay? I mean, like in the beginning of mankind, do we have words? No, right? But do we have images? Yes, everything is image. So you need to learn from there, okay? So once again, very less words. These are keywords. I don't care how you chain up your sentence. That's your freedom. Any question over here, guys? Can you understand? So this is second line, done already. So second line, your triangle, fever, inflammation, phagocytosis. Soalan essay penting, inflammation, dengan phagocytosis. If okay, type okay in chat box, I move on to your third line of defense. Okay, Can Very good. So move on. Third line, barisan pertahanan ketiga. Okay, so in third line of defense, we are already involved. What system? What system is in third line? Immune system. So can I ask you, are phagocytes part of the immune system? Our neutrophil phagocytes, are they in immune system? Not really. Is our skin a part of the immune system? Are our eyes part of the immune system? No, they are not. But third line, yes, they are. How can we say that the immune system? What's the keyword in immune system? Is they must be specific. What is specific? They must be able to identify specific pathogens. So what happens in immune system? Who can tell me? What happens in immune system? What happens? What happens? What do we call that? What do we call the whole process? Produce antibody, okay? I don't produce antibody, but what is that called? We call it as gerak balas keimunan or immune response. So I put in red box, this is very important. We are talking about immune response. Gerak balas keimunan. So what is immune response? I'll show you a few beautiful pictures, okay? Number one is this. Okay, so you must be able to label first, number one. You're able to label. So first of all, what is this cell called? I mean, it's not really beautiful. In reality, it should be round central nucleus. What is this cell? What is this cell? Lymphocyte. Okay, good. This is our lymphocyte. Okay, so what is this? This thing, imagine, is the bad guy. The bad guy. So this is the pathogen. Okay, so importantly, you kena ingat, dekat surface of the pathogen will have something called antigen. Okay, so this is something that you must know first. Lymphocyte, pathogen, antigen. So when the lymphocyte meets the pathogen, and the antigen on the pathogen, they will start to release these things after some time. What is this? What are these? Antibodies. So another important keyword in immune system is you must have antibodies. And these antibodies, they will go and bind on the antigen and remove it through one of the 5 methods that I will show you later. This is what we call as immune response. What explains the specificity of third line of defense? You must have a look at this picture. In every antibody, there is an antigen binding site. Antibody always looks like Y shape. They always look like Y shape. Tapi, dia ada satu antigen binding site. And this is very specific. Dia mesti ngam-ngam dengan antigen. The concept is something like lock and key hypothesis. Enzyme dengan substrate. So, dia punya antigen binding site mesti lengkap dengan bentuk antigen. Baru dia boleh bind. So, this is the reason why. So, if you talk about COVID-19 dengan dengue virus, do you think their antigen outside looks exactly the same? Definitely different. So, the way why it's specific is because of this. In which first line and second line doesn't recognize it. They just do whatever they do. Are you clear? These are all just bonds that you don't have to know. It's not your syllabus. Okay? So, antibody reaction. How many are there? Altogether are 5, right? I told you 5, right? But the way that we should remember is we should remember there are only two reactions. How many reactions? 2. Which 2? Whether they depend on phagocyte or they don't depend on phagocyte. This is not in your textbook. Your textbook don't divide like that. But actually what it means is like that. I want to make it more beautiful for you to study. What it means by depend on phagocyte, meaning whatever reaction that belongs to here, actually the antibody didn't kill the pathogen. The antibody, when it binds to the pathogen, it causes your second line to kill them, which are your phagocytes. So this, we have 3 methods over here. Number 1, agglutination. Agglutinan. Method number 1. So in agglutination, you can see the word blue inside. Which keyword is, I don't like, panjang lebar grandmother, grandfather story. I don't want. What's the keyword in agglutination? Tell me in the chat box. You are going to sit for exam already. Glue. Glue is how you should think. But in the exam, what is the word you want to write? Stick. No. Coagulate? No. The word is, in Bahasa Melayu, is mengumpal. In English, is clump. Okay? So what it means is that in agglutination, the antibodies, after they bind on the antigen of the pathogen, it will cause the pathogens to stick together, form a clump, and that will attract our phagocytes to come and kill them by phagocytosis. So this is what I meant by dependent on phagocyte. Meaning, when the antibody bind on the pathogens, causing them to come, are they dead already? When they stick together, doesn't mean they are already dead. They are not. They are not dead. You need someone to kill them, and who kill them? Phagocytes. So phagocytes are very stupid, isn't it? They are basically just following orders, basically. And some students ask me, how come we need the antibody? Because phagocytes are stupid. Sometimes the pathogens, they miss it. There might be some characteristics that cannot detect them. So this antibody make them smarter to see them, to kill them. Okay, that's number one. Number two is opsonization. Method number two. So opsonization, I want you to look at the word op at the beginning. Think of the word optic. What is the meaning of the word optic? You study in physics. What is optic? Optic means, for example, if you have problems with your eyesight, you go to the optic shop to get a spec. Am I right? So when you see the word optic, you remember the word see. You want to see things clearer. Am I right? If not, you blur, isn't it? You want to go to the optic shop to get a spec because you get blurred. Vision. So opsonization, after the antibody bind to the antigen of the pathogen, what's the keyword over here? What's the keyword? I don't want to know grandmother story. What's the keyword here? Very good. The keyword is marker. Petanda. So it's like X mark the spot, X mark the spot. They put a crosshair there. So the phagocytes go and mark it. That is opsonization. Number three, precipitation. Antibodies are different for different tasks. You're right. Different for different tasks. So precipitation or pembendakan, this is actually pretty easy to understand. It comes from the word precipitate, which I believe when we talk about Benedict's test, which we use to test for Benedict's test, Ujian Benedict test for what? Gula penurun, yeah, reducing sugar. Okay, am I right? Okay, we say that from blue to brick red precipitate. So what does it mean? What is precipitate? I told you that time. What is precipitate? Apa tu mendakan? What is it? It becomes like a solid. So in precipitation, what happens is from soluble becomes insoluble. You see, some pathogens if they can dissolve, right, it becomes invisible. How to see them? Dissolve, man. But this precipitation, they bind on it, make them visible. Like if you're in a game, right, they make invisible enemy become visible. So the phagocyte go and makan them. Okay, keyword soluble becomes insoluble. So these three methods, they need phagocytes to come and tolong to get rid of them. But there are two reactions that don't need phagocyte. They don't depend on phagocyte. One, lysis. This method, in Chinese, we say 简单粗暴. What it means is that when the antibody bind to the antigen of the pathogen, it causes the pathogen to, what's the keyword? What's the keyword here in lysis? Rupture or break. So the pathogen, hancho, turai. So you don't need phagocyte to help. They already, kill it already. Lysis. Another one, neutralization. Now this one I explained in my normal class in detail. Now this is not a normal class, so I just want to go through very quickly. Keyword is what in neutralization? What's the keyword in neutralization? The keyword is toxin. You're right. What is the meaning? In neutralization, they don't target pathogen. They target the toxin. Sometimes there are some pathogens that don't directly harm the cell. They will release toxins to destroy the cell. Any disease that you know, they do like this. It's not the pathogen itself, but the toxins by the pathogen. Any example of disease? Yes, very good. Tetanus. Tetanus. So when you are treating a person with tetanus, you cannot just give antibiotics, which is supposed to kill the bacteria. You must also give tetanus antiserum. Why? Because that freaking bacteria will release toxin. That toxin needs to be neutralized, and we use the process neutralization. So these are very fun, isn't it? It's like, when you play game like that, when you play game, the way they destroy the pathogen, it's like, how you play game to destroy the enemy. Like, again, I tell you, ladies and gentlemen, I believe in your ability to construct a sentence. So I just give you one word. This is a key word. Tapi saya percaya you ada capability untuk buat ayat kan. Alright, immunology is a subspec in medicine. Okay. Can I go on? Okay, next one, I'm showing you a few pictures. Okay, so I'm showing you a few pictures. Can you just quickly tell me what is this first picture? Showing you what is this? What do you think is this? This is agglutination. Okay, agglutinin. Because you see the pathogens are all linked up. The second one, what is this? What do you think is this? This is opsonization. You see the tertiary bacteria gonna X mark the spot. Okay, so this is opsonization. The third one, okay, the problem is your syllabus got a bug. Your syllabus got a bug. The bug is actually agglutination and precipitation. They look very similar in reality. So in how they can make you know which one is which is actually by telling you what is the thing. If they tell you things like soluble, then you know that it's precipitation already because they look very similar actually. So there are a lot of students always come and text me, sir, so is this agglutination and precipitation? I cannot tell you from the question they give you, that's a bug. They look the same. You can't tell. But if you tell me one is soluble, then I know that it's definitely precipitation. So look for keywords. Alright? This one, toxins, neutralization. Okay? Last one, the whole thing pecah. Mampus, lysis. Okay? Boleh? Boleh ah? Okay, next. Immunity. So we talk about the basic. Tadi tu semua basics here. Now we go into the real deal, which is the immunity. Okay? So in immunity, we are talking about the type of immunity. Type of immunity. How many types are there? Of course, in the beginning we got two. Active dengan passive. What's the difference between active and passive immunity? In active in active immunity, I always tell my student very easy way to remember. Active. Okay, how you want to differentiate an active student and a passive student? How I know whether you are active or passive? I can tell my student very easily, whether they're active or passive. Because usually, by talkative or not, no. Talkative doesn't mean that they're active. They might show that they're active, but it doesn't mean that they're active student. Okay? Active means, I see the Google form last time. Remember, I always give you a homework one, Google form. There are students who always do homework one, and there are students who always don't do homework one. So the one who do homework, active one. You do homework yourself, active. Passive means you either don't do homework or you copy answer from other people, passive. Okay? So, again, if it comes to immunity, active means what? Your own lymphocyte produce your own antibody. So you do your own homework. Sendiri punya lymphocyte menghasilkan antibody sendiri. That is active. Passive means what? Saling jawapan. So you get the antibody from outside. Faham? Simple. So these two immunity, what is the major difference between these two? Apakah dia punya perbezaan yang paling besar? These two. There are two main differences between them. Dua. Just imagine. When you do homework yourself, it takes more time, or when you copy homework, it takes more time. Which one? Of course, when you do homework yourself, isn't it? So, active immunity, it takes time. It will not be immediate. Understand or not? So, number one is it immediate or not? Which one gives you immediate effect? Serta-merta. Passive. You copy me, directly get answer. Am I right? So, number two is, most important one, how long can your memory last? Which one lasts longer? Copy homework or do yourself? Memory? Of course, active. So, that's the difference. When you are active, it might not be immediate. It takes time, right? But after you know how to do it already, thank God, your memory will last very long. But sometimes, it might not just be one time. You might need a lot of time for it to, really know how to do it. Okay? So these are the two things that differentiate them, actually, the two main things. Alright? So each of them, we can further divide them into natural or artificial. Okay? So we can divide them further into natural or artificial. This one also I will give you handwritten notes in my intensive course. So passive also sama, natural and also artificial. Okay? Same. Alright? Same only. So what's the meaning of natural? The simple way to understand is tak payah suntikan. No need injection. Buatan means need injection. Perlu suntikan. That's the easiest way. Sama over here. So remember last time I give you a chart for I give you a framework for our animal blood circulatory system. Do you remember that? Last time I give you a table. Remember? Okay. So it's the same. If you are studying in English, we always go from down to up or up to down. If you're English, you go for down to up. Meaning we got 4 types of immunity, namely natural active immunity, artificial active immunity, natural passive immunity, artificial passive immunity. Kalau you belajar dalam bahasa Melayu, is from up to down. Maksudnya keimunan aktif semula jadi. Keimunan aktif buatan. Passive semula jadi, passive buatan. Okay, so altogether you have 4 types of immunity. Okay, we go one by one. Again, I don't like bullshit one. I just want simple, sweet for you to understand and write in your exam. What is the keyword for natural active immunity? What is it? Natural active. That means you don't need to do any suntikan, but your body with the lymphocyte produce your own antibody. Keyword recovery. Sembuh. Not jangkitan. Infected doesn't mean you can get immunity. It's you recover. Why when you recover you can get immunity? Can anyone tell me? Why after you recover you can get immunity? What has happened in your body? What has already happened in your body? What happened in your body? Simple lah. Okay, B cell, all that. The keyword is you have already done immune response. So what is immune response? You have to go to my previous slide just now. Immune response means your lymphocyte detected the antigen on the pathogen and releases specific antibody. Okay? But what you say is correct. I agree with you. Lymphocyte ni memang ada dua jenis. Just like actually I told you in the previous chapter. We got 2 types. B cell dengan T cell. Cell B, cell T. BTS, right? I told you. BTS. Okay? But no S. BT, no S. So BT. Okay? So T cell, they generally directly destroy the pathogens themselves. They destroy the pathogens or pathogen-infected cells directly. Okay? So for example, if the pathogen really masuk into a cell, so the T cell will go and do the source control, they go and destroy it. B cell is the one that will produce antibody. Okay, Mariam? B cell will produce antibody. But you have to remember, after the B cell know how to produce the antibody, they will become something called memory cell. Memory cell, this is very amazing. Memory cell. In Bahasa Melayu, it's called cell memory. So this cell memory, next time when they see the same thing again, they can straight away produce antibody. The idea is like, okay, for example, right now you do homework, right? You do homework. Difficult question, very difficult. But finally you solve it. So your brain got memory already, right? Got memory already. So the next day you have your exam. The same question come up. Can you do it again? You can. Why? Because you have memory. Same. Memory cells stored in the brain. No. This memory cell is a type of white blood cell. They float in the blood. They are not brain. They are a type of lymphocyte. Memory cell is a type of lymphocyte. Understand or not? Okay? So next is we talk about artificial active. What does it mean? you need some injection, so you memerlukan suntikan, tapi at the end, you punya lymphocyte produce antibody. So, apa benda tu? What's the keyword? Keyword, I only want keyword. What's the keyword? Immunisasi ataupun vaksinasi. So, it's the same word. So, next time don't come and ask me again. Immunization and vaccination, what's the difference? It's the same. Same. Vaksinasi, imunisasi, dia adalah sama. So, what do you inject into the body? What do you inject into the body? You inject vaccine. What is a vaccine? Apa tu vaccine? This one is equivalent to soalan bocor. Soalan bocor. Meaning, next week is your exam. No need to say what. Next week is your paper 3 exam. I already know what question come out already. So I already teach you. I teach you, okay? You know how to do all this, how to do all that, you know. So you also learn already. When the real exam come out, can you do it? Can, right? Because you've done it before. But is that the real exam? No. But I give you something like that. So a vaccine basically is a pathogen that is already dead. It's dead. But they still have the antigen. So our, lymphocyte can still do immune response to it. Right? Okay, so what does it mean by natural passive immunity? Natural, no need any injection, but the antibody are from outside. Keyword is mother. Very good. The keyword is mother. For the baby, mother is an external source. Tapi the baby sebelum dia punya sistem keimunan jadi matang, they will get the antibody from the mother. How? Basically, it's through placenta ataupun susu ibu, breast milk. So for the baby, mother is a source of the antibody. So it's a natural passive immunity for the baby. Artificial passive is very straightforward. Basically, you inject anti-serum into the body. Apa itu anti-serum? Anti-serum is the specific antibody. So it's very simple. This thing, if it really comes out in exam, I really think you guys are so lucky. This is really very easy. I mean, it's really, 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 really very easy. Okay? So, I need to go on to the most important question that you can ever imagine. This question, okay, before that, vaccine. Okay? So I just want to tell you that vaccine basically is a dead or vacant pathogen lah. Okay, so even though they are dead, so they cannot cause any harm to your body, tapi dia masih ada antigen. So this is the antigen, am I right? So your body punya lymphocyte can still do immune response towards the antigen. Alright, so this is the vaccine. Now, we go on to this question important not you think in exam. This question, if you don't know how to do this question, you don't go inside exam. Okay, if you don't know this question, you don't go inside the exam. This question is very important. It can come out in objective, structured essay. Super important. Okay, but if you come out in exam, it's your luck because it's so easy. I always tell my students, okay, when you see this question, if you forget really, you forget already. How you want to remind yourself is to look at the front and look at the back. What does it mean? Look at the front, look at the back, look at the front, look at the back. What does it mean? What does this mean, guys? First of all, you must understand that there is something called immunity level ataupun aras keimunan. The y-axis is kepekatan antibody and the x-axis is the time. Basically what it means is that you punya kepekatan antibody mesti kena melebihi aras keimunan baru you ada pertahanan towards the pathogen. Faham? So for example, at this point, at 10 days over here, does this person already have immunity towards the disease? Is the person immune to the disease? Tak. Reason? How you will answer this in exam? Reason? At 10 days, why the person is not immune? So your answer is because kepekatan antibody masih di bawah aras keimunan. Tu je. Correct? Di bawah. Still below the immunity level. So, but if you look at the next graph, this one, after we inject the first week itself, boom, shoot up already. This is showing you what difference I told you just now, guys. What did I talk about just now? Whether are you serta-merta or not? So this graph over here, it's definitely not immediate lah. This one definitely is immediate lah. Then the next thing is, you remind yourself again at the back. This graph a bit stupid lah. In reality, it should go longer. It shouldn't chop so fast, isn't it? It should actually go long, right? But this graph looks a bit ugly lah. Okay, so this one not immediate but last long. This one immediate but drop very fast. This is called not long, temporary, sementara. Am I right? We're analyzing the graph right now, showing you how to understand it. So if you look at the next graph, next graph over here, okay. So what immunity is this? Number one, needs injection. Maksudnya, adakah ini buatan or semula jadi? Is it natural or artificial? You already need injection already. So it must be artificial. Number one, artificial. Number two, I told you because of these two characteristics, not immediate but last long. So this is active or passive. So we got the name. This is called artificial active immunity. And this one is artificial passive immunity. So answer me, what is this? What are we injecting into the person? What are we injecting to the person? Vaccine. Betul? What are we injecting to this person? Anti-serum. Senang. Then the next thing is what will be your next approach when you're writing essay? After this, what will be your next thing that you want to write? What will be the next thing you want to write in exam? Yes? No, but sebelum immune level. No. You follow my train of thought or not, guys? First of all, we have to look at front and back, right? Front and back, right? Then we define what is the name, right? Okay? We inject what, right? The next thing is what is it? What is this? Take over the must tell what is vaccine. Takkan just biar vaccine macam tu je. Then what is anti-serum? What is anti-serum? Specific antibody. So this one, again, you don't have to copy down because I prepare one table in your chat box, one table in your notes that you can copy down. Faham? Okay? So next, Alright, next is what, guys? It's about the duration and what kind of treatment is it. So if this one, okay, it's not immediate but lasts long, do you give this when you're infected? It's just like I'm asking you, just like I say vaccination, in real life, it's like what, guys? In real life, it's like what? It's like soalan bocor, right? I told you. Soalan bocor, am I right? So after your exam only, I give you soalan bocor. Do you think the soalan bocor still got use? So what is it actually? What is vaccination? Apakah imunisasi? What is it? It is a prevention. Pencegahan. So what is your antibody? The answer that you want is cure. It's a rawatan. So when do you give vaccination? When do you give a person soalan bocor? Before the exam. When do you give answer straight away? During. After the exam, you give answer. I cannot do anything already, ma. I already answer already. It's not after, it's during. During the exam, you give me answer is the most benefit one. After the exam, give me answer. For me to worry only. I salah already. If you want to give me answer, give me exam, give me wrong. So during. During, semasa you ada. Or high risk. What does it mean high risk? For example, today, you kena batuk by a ular. You kena batuk by a ular. Wah, the ular batuk your hand. And just run away. You go to the hospital. The doctor asks you, have you seen did you take a picture of the ular? No. You know how it looks like? Forget already. So at that situation, will you inject anti-serum to the person? Or no? Yes or no? Of course, the answer is yes, because you don't know whether the snake is poisonous or not. So, the high risk here means that kalau you rasa orang itu risiko dia tinggi, bagi je. If not, don't die. Okay? So what else we want to talk about? We talk about a lot already, a lot of differences already. What else can we tell? What else can we tell? What else? Cukup lagi. Immunization program, come on, we're still in this graph. What else can we talk about right now? Contoh? No. We need to tell what happened after first injection and what happened after second injection. That's the technique, the strategy in your exam. After talking all that thing, you need to talk what's the effect of these two. So after first injection, the antibody masih di bawah aras keimunan. You are not immune yet. But this one after first injection, straight away already, antibody is above. Then we need to do second injection. This is very motivating, isn't it? So this active immunity is just like you're doing question and then you fail in the first attempt. You cannot do it. So what's next? What's next? We need to give you a booster. In Bahasa Melayu, dose penggalak. Booster dose. So if I ask you in the exam, apakah fungsi dose penggalak? What's the function of booster dose? Is to, you see, this is very important. You want to increase the concentration of antibody above immune level. You must tell the examiner above or below aras keimunan. This is very important in your exam. And what about this? When do we need the second injection? When do we need the second injection? Tell me. Logic. Okay? Two situation. Number one is if the person is not recovered from the first jab. Haven't recovered yet, but the immunity already settled already, so you inject another one. Another one is you're gonna again. So, do you know how many slides we have gone through until now for this graph only? 4 graphs, 4 slides. 1, 2, 3, 4. This question, can it be 10 marks? Exam question? Can you do in your exam, most importantly? I hope that I am not feeding you knowledge. I'm not feeding you, okay? I'm trying to show you how to do it in exam. Please, 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 do it properly. Get in exam. Seriously. There is no way you all cannot do one SPM. I'm not sure. I'm not sure. After you join the course for 2 months' time, I'm not sure whether you all have more confidence or not. You just follow through my course only. There's nothing else you all can do. No need to do anything. No need. You don't need any other Mr. What, no need. You just join my course. That's all. Don't waste your money. Alright? Next one is HIV and AIDS. Okay? HIV and AIDS. This question can come up randomly in exam. So first of all, you must know how is HIV being transmitted. Okay? HIV is transmitted in these few methods. Satu is sharing of needles. Okay? Kongsi jarum lah. This is especially true for people who are drug addicts. So kalau penyakit dada, they might transmit through this. Satu is actually through pregnancy ataupun through breastfeeding. So this explains kenapa dekat Africa a lot of children young they will get HIV because it's actually from the mother to them. Alright? Next one is through blood transfusion. This one is dulu until now actually still got some risiko lah, but we already screen the blood very, very thoroughly. So the risk is very low right now, but it can still happen. So that's why before people get blood transfusion, they must get consent first. Okay? The next one is organ transplant, okay? And unprotected sex, especially this one. Is HIV the same as AIDS? It's not the same. Not the same. HIV is the virus. AIDS is the condition when your body T cell. HIV affects T cell. The BTS means T cell. Okay. So AIDS will only happen when your T cell is significantly low and you get infections easily. So basically, the problem of AIDS is that the patient's immune system is down. Understand? The patient's immune system is down and they get infections that normally people don't get. So once you reach that stage, you are AIDS. Otherwise, can you be a HIV patient but not AIDS patient? Can or not? Can you be a HIV person without AIDS? Of course, yes. Yes. That means you are HIV positive, but you haven't reached the point where your T cell is so low. How long it takes for HIV to become AIDS? It's for 10 years. But in the middle of any symptoms or not, might not. You don't feel anything until you get infections. Is HIV curable? The simple answer is no, but it's treatable. We can treat it right now using a medication called HAART, highly active antiretroviral therapy. Okay? Not curable, but treatable. HIV patients on treatment, their life expectancy is almost the same as normal people. Alright? So not much of an issue. So they shouldn't be stigmatized. The next picture is just trying to show you how does the HIV, affect the body. It affects T cell, I emphasize again. Okay, so this is the HIV. Basically, the HIV, they will first bind to the membrane of the T cell, then they will actually release the genetic material. So what you can see is that this genetic material, later they will go and combine with the T cell nucleus punya genetic information. So by doing so, it sort of like hack the nucleus of the T cell. The cell controls all cellular activity. So once it's gonna hack already, the cell, instead of doing normal process, they start to go and produce more and more copies of the HIV. So you see, eventually, the T cell, instead of supposedly used to fight infection, they go and produce more HIV cells. Why is HIV not curable? Because you can give them medications to destroy all this. Tetapi, there are some HIV that has already incorporated the genetic materials to the T cell. These are the ones that cannot be treated by the medications. Their genetic materials are already inside already, so they can produce HIV anytime. So you cannot stop the medication. Once you stop the medication, the cell will start to produce again all this copy, and you have viral load that is positive. Meaning, in simple words, a patient who is HIV positive, if they're on heart, they take medications, can they reach negative viral load? Meaning, we have something called viral load. We take the blood and then we check how much HIV in the blood. Can they reach zero viral load for HIV patient on medication? Can or cannot? Can or cannot? The answer is can. Can. That's what HIV medication is doing. They are actually killing all this. But then, zero viral load doesn't mean that you are cured, because this virus affects the nucleus of the T cell. This T cell, once they are hacked already, after you stop the medication, they can still produce HIV, and your viral load will start to climb again. So HIV patients, they need to take the medication every day until they die. Yes. Okay. So, thank you so much, guys, for listening. This is class 11. We have finished 11 chapters. Okay. So thank you so much. I'll see you guys again next week. Remember, next week belongs to November class lesson. Right? If you have any students or friends who want to come to the class, they should join next week, not in November. Okay. Thank you so much, and happy advanced Deepavali, students. Thank you. Bye bye.